A dentist is somebody like I was at Illinois. When you get done with your 4 years of basic training and you learn a little bit of this and a little bit of that, a little bit of all the specialties, then you go out and practice. And you practice with the knowledge base you have from these little tidbits you get in dental school, or what to me felt like tidbits. I always, whenever I did something, I wanted to really know as much as I could in that area. So I went the other way and said, well, I love gum disease or periodontics more than anything, and so I decided I wanted to go to perio school and become a periodontist.
It's important to have a dental implant performed by a periodontist or a surgical specialist other than a general practitioner, because we are really considered the plastic surgeons of the mouth. And we know how to handle gum tissue much more effectively than your average general practitioner. I mean, it's a specialty, and we've done extra 3 years of training. We want to make sure that the gums look natural. We want to make sure that the crown of the implant emerges through the gum tissue just like your natural tooth did. So to have it done by a plastic surgeon, or one that's a specialist that's considered a plastic surgeon of the mouth, is especially important.
Perio, I loved doing it, but I loved it more because it was a specialty where you had to know everything about everything. So it wasn't a specialty where you learned how to do your little procedure and it was outside of the rest of dentistry. It was really inclusive. So you had to learn all about orthodontics and braces and bites, because that affects how healthy the gums were. And you had to learn about fillings and restorations and crowns and aesthetics, because that affected how the gums reacted. And you had to understand gums, how they affected all the rest of it. So it was a great specialty because it all interacted. Even like root canals and gum disease sometimes look like they're the same. So it was a great specialty for me because I got to learn more about everything. So it was a couple years of training, very intensive, and gave you a good handle on being more proficient at diagnosis and treatment planning and treating.
The difference between a periodontist and a dentist is really the training. There are many dentists that do procedures that specialists do, but the specialists, periodontists being a specialist, have considerable training. And that's training not only in surgical technique, but also in treatment planning and helping patients move forward so that the overall result is much better.